We'll be discussing prostate cancer today. Hi, I'm Dr. Manish Jain for Cancer Talks. This is a cancer which is happening to only males. This happens in an organ called prostate, which is a small walnut-shaped gland which is located somewhere between the urinary bladder and the ureter. So it is located in the pelvis. This produces seminal fluid which nourishes the sperms. Normally that's the function of this gland. Generally, this is an age-related cancer, so this happens mostly over age 50. It is only for males. It is 1 in 9 will develop prostate cancer in their lifetime. With the changing lifestyle, with the kind of the way our lifestyle is and the way we are living and we are going to survive longer, the chances that the Indians would catch a prostate cancer is also going to be similar to the Americans, because it is an age-related cancer. So it generally starts at median age of 67. So a person has to survive to that age. The longer you live, the higher is the chance of getting prostate cancer. And the burden is going to increase by 2030 in our country significantly for this cancer. So it is not clear why this prostate cancer happens to a person. So there are some DNA changes happening in the prostate which will then these cells, they continue to proliferate and then go into cancer. But there are no clear causes which can be attributed. There are certain risk factors, we'll discuss that. So whenever there is an abnormal cell which forms in that tissue because of some DNA changes, then that will start becoming cancerous. Then it will invade into the prostate gland, into the surrounding, then enter into the lymph node, and through blood and lymphatics it will spread into the body. So that is how the cancer originates, and it's a slow process. So generally these cancers are slow growing cancers, but some of them can be aggressive. So if you look at risk factor, the first risk factor is age. If age is more than 50, then family history. If somebody in the family has got cancer, or if there is a BRCA1 or 2 gene affection with somebody in the family, or if the person has a genetic syndrome like Lynch syndrome, then they are all at risk of prostate cancer also. Obesity has a direct link with prostate cancer. 60% of the prostate cancers are directly linked to obesity. So if your BMI is high, if somebody is obese, sedentary lifestyle, non-exercising person, so they have a more aggressive tumor compared to a lean person. So even aggressiveness of the tumor and the chances of tumor are higher in obese people. How do we diagnose prostate cancer? Who gets it? It's like supposing somebody has got a difficulty in micturition, he's got frequency of micturition. So micturition is passing urine, or if they have decreased flow, they cannot have a good flow to urine, or if they have blood in urine, if they have painful ejaculation, if they have painful urine, if they have urine at night time which is quite higher. It can be also in diabetes, but if it is quite frequently in night time, the person is not diabetic or well controlled. If there is an erectile dysfunction, they are unable to pass urine, that also could be one of the symptoms of prostate cancer. When the cancer spreads, then it can cause, like if it spreads to bone, which is the most likely space or area of prostate cancer spread, then they get backache, bone pains. If the bone is involved significantly, then because bones are manufacturing blood, there can be anemia. There can be weight loss because of the cancer cachexia. Means when the cancer is gone to bones, it is stage 4. And in a stage 4 cancer or any cancer, generally a person starts losing weight. Then the seating area can be a painful situation because that's the area of prostate. So if the prostate gland is enlarged, then it can cause even pain in while sitting, or it can cause change in bowel habits. So because it can compress on the rectum, and that can cause difficulty in passing motions also. Generally, screening is done for patients or people who are above age 50. It is simple. You can, the urologist can put a finger and do a digital rectal examination, or can get a PSA done. If PSA is raised and it is higher than 15, then the chances that cancer is there is almost more than 90%. So that is how, and how do we diagnose it? So whenever you have prostate malignancy suspected, the first thing is biopsy of the prostate. So you have to do a transrectal. So what we do is we take the patient in a posture where we put a ultrasound guided needle into the prostate from the rectum and take a piece. So this is called TRUS, transrectal ultrasound guided biopsy. So once you have collected enough sample, or you can do it even under MRI guidance, but it is simpler to do it through sonography. Why it is important? You need to do certain scoring. So we do Gleason scoring. Gleason's is a way of looking at the aggressiveness. The aggressive part is 8 to 10. The lowest part is 6. 7 is in between. So genomic testing is another one. Whenever the cancer is spread, you also ask them to do an HRR or testing, or the genomic testing, MSI. So this will tell you whether there are certain drugs which are going to be working against this. Generally, to determine the spread, what we do is we get there either bone scan, CT scan, or we do a PET CT scan. And some patients we also do an MRI if we have to look at the prostate in details. So once we see whether it is localized prostate cancer or metastatic prostate cancer, the treatments are going to be different. In a localized prostate cancer, you will also look at the PSA value, the Gleason score, and based on that and age, you will be deciding on their treatment. So if somebody has got a prostate cancer which is localized, PSA score very low, maybe 5 or 7 or less than 10, and age 75, you know that this person can anyway live normal life even without treatment. So in certain cases you don't even treat prostate cancer, but in some cases where the PSA is high, Gleason score is high, patient is young, so you will have to treat them. The treatment is for metastatic prostate cancer. Then what we do, we will be doing two things. One, we will be blocking their hormones. So hormone blockage is done by two methods, either surgical or by injections. Now, when do we give chemotherapy along with hormonal therapy? Like supposing somebody has got a lung mets or liver mets, then we have to give them chemotherapy along with the hormonal therapy, what we call ADT. How do we prevent this cancer? That's the most important thing, because if prostate cancer happens and then you do the treatment, it can be prevented. Now this cancer can be prevented 60% of the times very easily. And what do you need to do for preventing the cancer? You need to be lean. First thing, don't put on weight. If your BMI is high, then your BMI has to be brought down to less than 30. That's the first part. The other way you can look at is your height. If it is supposing 160 centimeter, then your abdominal girth should be not more than 80 centimeter. If you are 170, then accordingly 85 centimeter. So your height divided by 2 should be your abdominal girth. That's the easiest way to look at your own thing. The second thing is exercise. You should do 30 minutes of good exercise, means moderate intensity. So if you are doing walking, that is not considered exercise. You should be doing some dynamic exercise, cycling, running, climbing, or climbing a hill, any of those things where you sweat and you become like, fatigued out. So you need to fatigue your body 30 minutes every day. So maintain your healthy weight, exercise every day, choose right food. Now food is something very important. So it should be high in, so 5 portions of your food should be fruits and vegetables. You should be eating less of fat, less of cheese, less of processed food. So this should be definitely, and you should be eating more of nutrient food rather than empty calories. I think prostate cancer is the most preventable cancer, but the way we are living life right now is making it grow. We should avoid that and we should become lean and fit. Thank you.